Artime. I'm a student nurse practitioner in Nursing 612 Advanced Health Assessment. I'm going to be doing a head-to-toe assessment today. My friend Gail here, who has volunteered for us. I have already had Gail change into a gown, which I know she's not wearing, but she's changed into a gown. She's already voided, and we've obtained a full set of vital signs, including blood pressure and height and weight, which appear to be normal findings on exam for her size and weight. So the first thing that I'm going to go ahead and do, Gail, is I'm going to come in and just take a look at your facial features, noting symmetry of the eyes, that the pinna of both of your ears appears normal as well on exam. I'm also going to look at your head, noting that there's no crepitus of any of the bones of the head. If you've ever had any head trauma at all before. Okay, there's no lacerations or nodules either, and she's got even hair distribution throughout her head as well. I'm going to also palpate the sinuses, noting, and let me know if you feel any pressure when I press over your sinuses. So the frontal, the ethmoid, sphenoid, and the maxillary sinuses, which she doesn't appear to have any pain on exam. The next thing that I'm going to do is to go ahead and have her do a few series of exams for me, Gail. So I'm going to have you go ahead and stick your tongue out for me, okay? And then go ahead and clench your teeth, and then go ahead and puff your cheeks out, and smile, and then raise your eyebrows, and then press your eyes, squint your eyes. There you go. Very good. And all of the cranial nerves appear to be normal on exam. We're also going to go ahead and test for light sensation, so I'm going to go ahead and have Gail close her eyes for me, and then go ahead and tell me if you can feel it. Okay, very good. And then also the next thing that I'm going to go ahead and do is just take a look again at her face. Her eyes appear normal on exam. She has good skin coloring and no irregularities to her face. There are no marks on her face or anything like that. Her eyes appear level, and she has good hair distribution of her eyebrows and her eyelashes as well. She has no drainage or crusting or any lesions to the outside or inside of the eyes. I'm going to go ahead and take a look at your eyes. Just go ahead and take a look at my nose here, looking at the sclera of the eyes, noting that the sclera of the eyes is clear on exam, and I'm also going to look at the conjunctiva of both of the eyes laterally as well. And she doesn't appear to have any irregular vascularities of the eyes either. The next thing I'm going to do is do a series of tests for eyes, just to test movement of the eyes as well. So Gail, I'm going to have you follow my hand on both sides, and just follow my hand here. Very good. And this is testing the 6 cardinal fields of gaze. And then I'll have you look here, look forward, and this is testing for accommodation of the eyes. Next thing I'm going to do is go ahead and take a look at the inner side of the eye. So I just want you to go ahead and look forward and be at my nose, and then we're going to be testing to make sure the pupils are equal and reactive to light and accommodation, which they are 2s to 3s on exam. I'm also going to go ahead and do a test, confrontation test. So Gail, I want you to go ahead and cover your left eye for me, and then look straight at my nose, and then let me know when you can see my hand in view. Okay, very good. And then we're also going to be testing for strabismus and nystagmus of the eyes. So I'm going to cover your eyes and just continue to look at my nose. Okay, and she doesn't appear to have any deviation to either one of the eyes. The next thing that I'm going to go ahead and do is take a look at Gail's ears, noting that the auricle appears normal on exam. She has good skin color and temperature. It's normal with her neck as well. She has good recoil of the pinna of her ears, and I can see that the tragus is normal in appearance as well. She doesn't have any drainage to the outer ear. And then we're going to go ahead and take a look at the inner ear, noting that all bony landmarks are normal, or that I can see all bony landmarks in the inner inner ear, and I can, and I see a good cone of light. And also for an adult, we would pull up and back to view the inner ear. And I don't see any holes to the ear canal either. I'm also going to take a look at this ear as well. There's no cerumen, either the bony landmarks are normal on appearance. She does have a good cone of light, and I don't see any hole to the inner ear either on that side. Now I'm going to go ahead and do a couple of hearing tests with Gail. So, Gail, I want you to let me know. This is the Weber test that's testing for bilateral hearing in both ears, and let me know if you can hear equally in both ears. I'm going to strike the tuning fork. Let's sit on top of her head. And she can hear, okay. And then we're also going to test the rhyme, doing the rhyme test, and I'm going to hit the tuning fork as well and place it on her mastoid bone, and you let me know when you no longer hear anything, okay? And then I'm also going to hold it to her right side of her chest as well. And let me know when you no longer hear any sound. Okay. So it should be a 2-to-1 ratio for bone to ear conduction, and it does appear to be a normal finding. I would do that bilaterally to both ears as well. I'm also going to go ahead and do the whisper test with her. So Gail, I want you just to go ahead and I'm going to whisper something in your ear. You tell me what the words are and repeat them back to me, okay?
Color dog cat. Rainbow house light.
Okay, very good. The next thing that I'm going to go ahead and do is, again, just looking at her nose, noting symmetry of the septum. And then we're going to go ahead and take a look at the inside of her nose. So I want you to just go ahead and tilt your head up for me. Looking at the inner sinus cavities, noting that there's good, I can see the turbinates of the sinuses. She has a little bit of redness, possibly due to allergies, but otherwise there's clear drainage from her sinuses, so that is a normal finding. The next thing that I'm going to go ahead and do is just to take a look at Gail's mouth. So I'm noting that the lips look symmetrical, they're good in color, and also they're not dry on exam. I'm going to have you say for me, open your mouth. Okay. And she's got a good gag reflex. Sorry, Gail. But I noticed that the uvula hangs midline when she says the posterior pillars of the mouth appear also good and pink on exam. There's no redness or swelling. I can see the tonsils to the back of the pharynx as well. She doesn't have any nodules to the back of the pharynx, no abnormal markings. And then she has good redness to her buccal mucosa. Thank you for smiling, Gail. She has all of her adult teeth, which appear pearly white in color. And I can see the upper and lower palates are also red and look normal on exam. There's no abnormal findings to the roof of the mouth. And then also her tongue doesn't have any ridges noted on exam either. The next thing that I'm going to go ahead and do with Gail is just to take a look at your neck, noting there's smoothness and symmetry of the neck. I'm also going to go ahead and just palpate your trachea, noting that your trachea is midline. Also checking each of your carotid pulses, noting that there's symmetry, rate, and rhythm to each of the pulses, and we do those one at a time. The next thing I'm going to go ahead and do is just palpate around Gail's thyroid, and I want you to turn your head to the right and go ahead and swallow for me. Very good. I don't feel any nodules or abnormal findings around her thyroid. When she swallows, it doesn't appear to be enlarged on exam. The next thing that I'm going to go ahead and do is just to do a couple range of motion exercises to the upper chest, and the head and neck. And so I'm going to have you shrug your shoulders for me, Gail, okay? And then go ahead and do some passive or active range of motion. I want you to turn your head to the right and left, and then go up and down. And I want you to go ahead and push up against me, and push down, push to the right, left. Okay, and then, so the next thing that we're going to go ahead and do is, and then I'm going to go ahead and actually take a look at your chest, just noting the symmetry of color. There's no crepitus of the chest either when I'm pressing down. I'm going to go ahead and take a look at your, I'm going to go ahead and auscultate your carotids and also your thyroid with the bell of my stethoscope, noting that there's no irregularities, no bruise heard on exam. And it doesn't appear that there is. I'm also going to go ahead and take a look at the nodes of the head and neck as well. So I'm going to palpate the pre-auricular, post-auricular, and then I'm going to palpate the superficial cervical, the posterior cervical, and then deep cervical, and then occipital, tonsillar, submental, submandibular. And the other thing that I'd like to check while we're still focused on the head is I want you to go ahead and open and close your mouth for me. Noting that there's no clicking or any pain noted on exam when she opens and closes her mouth, which would be assessing the temporomandibular joint. And also I'm going to look for any jugular venous distension of the neck too, which does not appear to be present on exam. So that's the head and neck for the most part. And then I'm going to go ahead and take a look at Gail's arms, noting that she has good symmetry and color of her shoulders, arms, and her hands. There's no irregularities and masses or nodules noted on exam, no dryness to the skin. I'm going to take a look at her fingers and notice that there's no clubbing of the fingernails. Her cap refill is less than 3. She doesn't have any fissures or any skin tags or anything like that. No irregularities around the nail beds. And then also I'm going to have you flip your hands over, noting that checking the radial pulses, noticing that there's good rate, rhythm, and symmetry of both of the pulses on each side, and also palpating the brachial pulses as well. The next thing that I'm going to have you do is, can you turn around for me, Gail? And I'm just going to take a look at your back as well. So the thing that we're going to note on Gail is she has good thoracic configuration. She appears to have normal rate and rhythm symmetry of both of her lungs. She's got good musculoskeletal development. And I want you to take a good deep breath in for me, checking for expansion of the lungs, which does appear to be normal on exam. I'm also going to palpate across her costovertebral angle, and you don't feel any pain when I'm pressing there. Okay, I'm also going to percuss over the costovertebral angle, and if there was any pain, that would note that there might be some enlargement of the kidneys. So the next thing that I'm going to go ahead and do is just to percuss across her back, noting that there is resonance on sounding when I'm percussing across the back. I'm also going to go ahead and check for tactile fremitus, so I want you to go ahead and say 99 as I press my hands across your back. Okay, Gail? 99, 99, 99, 99. And this is also checking to make sure that there's resonance and no consolidation in the lungs themselves. I'm also going to go ahead and check for diaphragmatic excursion. So I want Gail to go ahead and take a deep breath in for me. And we're going to percuss down the side of the back, noting an area until there's an area of dullness. And I'm just going to lift your shirt up just a little bit so I can mark on your back, okay? And then also take a few regular breaths for me, Gail. I'm also going to percuss down your back until I feel an area of dullness when you take a breath out. So she was breathing out. I'm going to go ahead and mark that as well. And then we will get our measuring tape out, and I'm going to go ahead and measure the distance from her breathing in to breathing out, and it should be 3 to 5 centimeters on exam, which is normal. Also, the next thing I'm going to go ahead and do so the next thing I'm going to go ahead and do is to take a look at, we're going to go ahead and take a look at Gail's, noting that she has good symmetry, color, no irregular nodules to her back or anything like that. And then we're going to go ahead and take I'm going to also go ahead and percuss down the sides of her chest, noting that there's that there is resonance to percussion as well, going down the lateral sides of the back. I'm also going to listen to the back, going back and forth, and listening to the lateral sides of the lungs as well. I'm going to take a deep breath for me, Gail. And I don't hear any irregularities, no rales, bronchi, or crackles to an exam. I'm also going to listen to the lateral aspects of the lungs. And to the side. Okay. And Gail, can you turn around for me? We're going to go ahead and take a look at Gail's chest. So the first thing I'm going to note is there's even, she has no accessory muscle usage. She has even respiratory rate and breathing on both sides. Noting that there's no precordial heaves, thrills, or pulsations to the chest, and then there's normal skin symmetry. There's no crepitus when I press on the thoracic, the upper chest cavity, so she's never had any injuries there. I'm also going to go ahead and check for tactile firmness to the anterior chest, so I want you to go ahead and say 99. 99. Also noting that there's no consolidation of the lungs there. And then I'm also going to percuss across the chest cavity as well, noting that there's no consolidation of the lungs either when I'm percussing across the chest. I'm also going to go ahead and listen to the anterior chest, listening to the lung sounds initially, and then we'll move on to the heart sounds. I'll take a couple of deep breaths for me. Okay, very good. Okay, so the next thing that I'm going to take a look at is listening to Gail's heart sounds. So I'm going to listen for an S1, S2 sound. And I can hear that sound, that there's no clicks or murmurs on exam. I'm also going to listen to the aortic impulses. So I'm going to listen to the aortic and pulmonic, which would be in the second intercostal spaces. I'm going to listen to Erb's point, and then to the tricuspid and mitral valves. And I'm also going to note the left mid-axillary line and go down to the fifth intercostal space, listening for the point of maximal impulse. And then I'm going to palpate there as well, noting that I can hear it, or I can hear and feel the point of maximal impulse right there. And then, so the next thing that I'm going to go ahead and do is just have you lay back for me, Gail. We're going to take a look at Gail's abdomen. First, I'm going to auscultate for vowel sounds, which it shouldn't be any more than 5 minutes on exam when you're listening for vowel sounds. Otherwise, there could be a problem with motility of the vowels. I'm also going to just look at normal symmetry of the stomach. That doesn't look like there's any lesions. Skin temperature is normal as well, and checking for like contour of the abdomen while flashing light on her belly. And it looks like she has normal contour of her abdomen as well. I'm going to listen for vowel sounds. Okay, she appears to have normal vowel sounds in all 4 quadrants. I'm also going to go ahead and check for her aortic pulses. So I'm listening to the aorta, the renal arteries, which are on the right and the left, and then the iliac, and then the femoral arteries as well. And then you appear to have normal rate rhythm, and I can hear them on exam. The next thing that I'm going to do is just percuss across her abdomen, noting that there should be tympany on exam. And then I'm going to go ahead and percuss over the right down the right side until I feel an area of dullness, and that'll know where the liver is located. Okay, I'm going to go ahead and mark my findings here. And then I'm going to percuss up from the iliac area until I feel an area of dullness. And this notes the lower margin of the liver. The other one that I marked was the upper portion. So we're going to mark there as well. And then I'm going to measure my findings. It should be, so the liver should be 7 to 8 centimeters length on exam, and it is a normal finding. The next thing I'm going to do is just to palpate over Gail's abdomen, noting that there's no masses, any lesions. She doesn't have any hernias that are apparent on exam. And then I'm going to do some deep palpation. So I want you to go ahead and take a deep breath for me, Gail. And we're going to palpate the margins of the liver border. And I can feel the liver. It's typical that you can feel it on a skinnier person. Gail is a thinner individual. And then we're also going to percuss up from the left mid-axillary line to an area of dullness. And this would denote the spleen is located here. I'm also going to do deep palpation of the spleen, see if I can feel anything, and palpate underneath the ribs, which I don't feel anything on exam, and that's a normal finding. And then I'm going to have you take a deep breath for me, Gail, and I'm going to palpate over the right kidney. And I don't feel any masses. I don't feel the kidney either, which is also a normal finding typically. And then I'll have you take one more deep breath for me and palpate over the left side. And noting that I can't feel the kidney on that side either. Okay, so that concludes that exam. I'm going to go ahead and take a look at her legs, noting symmetry of the legs. She has good muscle tone of the lower extremities. Also, go ahead and kind of lift your legs up for me, Gail. Very good. She's got a very good muscle tone. And then go ahead and bend your legs up one at a time for me. Very good. She has good symmetry of both of her legs. Temperature appears warm on findings. She doesn't have any skin lesions of any kind, and there's normal hair distribution, like I said. The next thing I'm going to do is just go ahead and palpate her pedal pulses. We can palpate them both at the same time. I'm noting that I can feel them. There's normal rate and rhythm. And also her posterior tibial pulses, which are also normal on finding. And then the popliteal pulses as well, which are also normal on exam. And then we're going to go ahead and check for some reflexes. So I'll have you just hang your legs over the side. I'm first going to just check your brachioradialis reflex. So I'm going to strike here, and I do see that there's a good reflex on exam. And then also strike right over her upper wrist for the brachioradialis on this side too, and I do see a good reflex there. Then we're going to check for the patellar reflexes. Very good. There we go. And there was another good reflex on the right side. And then we're going to check for the posterior tibial, not posterior tibial, I'm sorry, the Achilles tendon reflexes. And then nothing on this side as well. And she has a good reflex on both sides. The last thing that we're going to do is do some more range of motion. So I want you to go ahead and move your arms for me, Gail. Just kind of swing them back and forth, kind of noting that she has good movement of her upper shoulders and her chest. And then go ahead and pull me forward and then push me back. Very good. And then I'm going to have you stand up for me. And then go ahead and just do just kind of squat down for us, noting she has good musculature and movement of her upper legs and lower legs and her chest and her upper torso. So the last thing that we're going to do is just going to have you turn or bend over, and I'm going to take a look at your spine and noting that she has good symmetry of her hips as well. I look and see that there's no deviation to the spine either. That I can see the cervical and lumbar areas of the spine, and she doesn't appear to have any tufts of hair or any abnormal findings on the lower part of the spine either. Okay, go ahead and stand up for me, Gail. Okay, that concludes my head-to-toe assessment. I hope you all enjoyed and you find this very informational.